Side effects of thiazide diuretics are one of the very important concepts which are tested in step 1 as well as step 2 examinations, and this is something that you should remember by heart. If there is a scenario, they will usually give you a scenario which will be self-explanatory, that the patient has hypertension because of any cause and the patient is going to take thiazide or is already taking thiazide diuretic. So the scenario will be very clear about this. If they are going to ask you what are the side effects that the thiazide diuretics are going to advocate to the patient, this is going to be a simple scenario. Patient with hypertension taking thiazide. So now it's your job then to remember that thiazide are the drugs which affect many metabolic pathways in the body. So for example, they cause increased glucose levels in the blood. So hyperglycemia is one of the side effects. Then they also increase the LDL cholesterol. They also increase the plasma triglycerides, and they also increase the uric acid level. So these are all super important for your exams, right? And they can ask this in many different ways, but if you remember that thiazides are going to increase sugar levels, glucose, LDL cholesterol, uricemia, so all these. So if there is a patient who is then taking thiazide in high doses particularly, is also susceptible to have gout episode, because thiazides are associated with increased uric acid level. So all these things you should know and understand, and actually I would say remember by heart. And most of these side effects are actually dose dependent. So if the person is taking high doses, then the side effects are very common. So up till now I told you the things which are increased in the blood. Thiazides also decrease a few things, and those also should be known to you. So for example, thiazides decrease sodium levels, so they cause hyponatremia, hypokalemia, and also the magnesium levels are down, hypomagnesemia. But calcium levels are increased. So overall, if you summarize this, there are stuff which are increased because of thiazide, there are stuff which are decreased because of thiazide diuretics. So ions which are decreased are sodium, potassium, and magnesium. Calcium is increased, uric acid increased, cholesterol, LDL, and triglycerides increased, and also glucose levels go up because of increased insulin resistance. This is super high yield, and you must remember this.